Pharmacodynamics, effective, affordable healthcare.
What plays a bigger role? Psychological causes or physical causes when it comes to erectile dysfunction?
You know, in the old days, and I mean 30, 40 years ago, they said it's all in your head if you have a problem with erections. So it's psychological, and you should go see a shrink, a psychologist, and they should sort it out. And nowadays, we know that if we want to give it a figure, but 90% plus of erection problems are organic or medical.
Really?
And only about 10% are pure psychogenic. So always, if there's a medical problem and the man has an erectile dysfunctional problem, it will have an effect on his emotions, his psyche, his relationships. But we now see medical problems as the underlying cause or reason for erection problems.
What kind of medical problems would lead to ED?
You know, if you think of it, what a man needs to get an erection is a stimulus, and mainly it is what you see, what you think, and touch. The second thing that you need for an erection is blood supply to the penis or the spongy tissue in the penis. The third thing that you need is the nerves need to be able to conduct the messages down to the penis to put this whole process of an erection together. Then the fourth thing is the spongy tissue in the penis should be healthy, and the fifth thing is you need male hormones.
Right.
So if you take those 5 prerequisites for an erection, things can go wrong on very many levels, or a combination of them. Today we know that the 4 major risk factors for a man to develop cardiovascular disease, which will result in either a stroke or a heart attack, myocardial infarction, is smoking, diabetes, high blood pressure, and high cholesterol. But the same risk factors are also risk factors for erectile dysfunction.
Okay, well, on that note, what medications are known to affect someone and lead to erectile dysfunction?
As you say, another cause for erectile dysfunction, although not a huge factor, is medication. We know, and we've already said, that one of the risk factors for developing problems with erections is high blood pressure.
Right.
But there are high blood pressure tablets that can also have an effect on the erections. Not all of them, and doctors are well equipped and they know about this. But it is what we call the thiazide diuretics, and then some of the older beta blockers. But the other antihypertensives, treatment for high blood pressure is not a problem. Then some of the drugs that people take for anxiety, and especially also the antidepressants, can have an effect on your erections. Then there's some drugs that will lower your hormones that function like an anti-androgen, and androgens is the male hormones. They can also have an effect on erections. So quite a number of medications that could affect your erections.
So you should consult your doctor, obviously, if this is something that
absolutely, and ask the doctor, and the doctor would know. And especially a guy that, for instance, for his high blood pressure takes a thiazide diuretic, the doctor could then change the medication to one that is more erectile friendly or penis friendly, if you want to put it that way.
Pharmacodynamics, effective, affordable healthcare.